Hello, this is the Advanced Diabetes Group in Hendersonville. This is Ryan Neal. Other group members are Nick Vlos and Leslie Firth. Today we're going to cover the diabetes devices, the Novo Flex Pen, the Lilly Quick Pen, and the Solistar Pen. I will start by going over the Novo Flex Pen. And depending on the color of the pen, it comes with three types of insulin: insulin Detemir, insulin Aspart, and mixed insulin 70/30, which is insulin Protamine and insulin Aspart. The insulin Detemir is a long-acting insulin with an onset of about 1 hour and a duration of 6 to 23 hours. It's administered subcutaneously once daily. Insulin Aspart is a rapid-acting insulin, and its onset is about 15 minutes with a duration of 3 to 4 hours. It's dosed subcutaneously 5 to 10 minutes before meals. And the mixed insulin 70/30 Novolog is rapid and long-acting, with a duration of about 18 to 24 hours and the same quick onset because of the rapid component. That's dosed 2 times daily to cover 2 meals and a snack. Extra supplies you'll need would be the NovaFine or NovaTwist needles, alcohol swabs, a way to sanitize your hands beforehand. The pen is capable of delivering anywhere from 1 unit up to a maximum of 60 units per dose. Warnings and precautions are typical for insulin, hypoglycemia. Patients should be aware of that so they can report it if they feel they're having an episode. Injection site reactions, allergic reactions, and if a rash or difficulty breathing develops, they should call for emergency help. To store the device, you store it in a refrigerator away from the freezer component in the pharmacy, and you keep the cap on to protect it from light. And then you could also store the Levemir Flex Pen for 42 days at room temperature, the Novolog Flex Pen for 28 days at room temperature, and the Novolog Mix for 14 days at room temperature. The directions for use for this pen: first you'd want to start off by sanitizing your hands. And this is a blue pen, so we're going to treat it as if it was a mixed insulin pen. And so you start off by that. It should look cloudy. So you want to mix it by rolling it in your hands about 10 times and then moving it up and down about 10 times. Afterwards, you want to double check that the insulin is uniformly cloudy. So first, you want to also check to make sure the pen is the right kind of insulin. That's very important. You want to make sure you're administering the right drug. So start off by taking an alcohol swab as well. Swab the site, go ahead and get that done. If the pen's been used before, you can swab the top of it there. Take the needle. I had just previously unwrapped this one. If it were new, it would have a case over it or cover. Take that, twist it onto the pen to lock it into place. All right, screw it on straight and tightly. Then remove the cover and check the flow in the needle with an air shot of 2 units. So you would twist this to 2 or about 2. You could do more if you wanted. The idea is when you push it out of the pen, you want to make sure that you actually see insulin come out of the top. And that way you ensure that there is no air bubbles. There are no air bubbles in the pen. You want to do this before each use as well. Okay, and so then before you tap it, you do that, you would want to tap it out too. Sorry, I missed that step. So basically dial it to 2, tap it out, and make sure there's no air bubbles. Then you would want to select the number of units you need with the dial. So let's say you're administering 12 units. Dial it up to 12. It's pretty easy to see on the little window here. And then you want to insert the needle subcutaneously and press the button all the way in. If it's difficult, make sure you kind of secure your hand so you don't hurt yourself when you're doing it. And when you inject it, make sure you hold it into the skin for 6 seconds after injecting, which is roughly about now. Then you want to discard the needle immediately in a sharps container. You can take it off in the reverse manner and throw it into a sharps container. And then, which we don't have, so I threw that on the table. Do not do that. Then you place the cap back on the pen, protecting it from light, and keep it in storage out of the refrigerator. And for this mix, it would be 14 days at room temperature. Okay, what else you need to know about this device is that it may be preferred for particular patients. For one, it's pre-filled, so it's easy and convenient. It's easier for compliance. It's discreet. It can be carried in a purse, and it doesn't have to be refrigerated. Again, all these make administration and storage easier and make it an easy-to-use product.